So my name is Julian Ryder. I work at the faculty as a Director of Education, Standards and Advocacy. Amongst other things, I manage the education and training team and have been working with them to take the exams online over the last 12 months or so. And Fatih and Dalia will be speaking a little bit about that in the next few minutes. So special interest groups, SIGs. Fatih and Maggie both mentioned the SIGs, and so if you're wondering what they are, you're about to find out. They are special interest groups, kind of says what it says on the tin. Groups of faculty members with an interest in a specific policy area. So groups of people within the faculty who are interested in a particular part of public health get together in a sort of fairly formal or informal basis, depending on how they want to run it. And discuss policy and come up with policy positions, policy initiatives, and work on behalf of the faculty. A fantastic source of knowledge and expertise for the faculty. You've probably gathered already that public health is a huge, vast sort of empire. And in the UK and in England alone, the people in public health work in a huge range of organisations. Obviously, in England alone, there's 150 top-tier local authorities. There's Public Health England. And lots of other employment settings. And of course, from Thursday this week, the employment situation becomes even more complicated and disparate with the abolition of PHE and the moving of PHE staff to roles in the Department for Health and Social Care and the UK Health Security Agency, amongst others. So it's a very complex, fractured sort of employment situation. So there is no one place really where public health policy is discussed and convened. And that's part of the role of the SIGs and those members of the faculty to get together to discuss policy and for the faculty to bring their policy together and codify it and make sure it's coherent and has a chance to be aired and broadcast. As I said, faculty public health is a really broad church. It covers a huge array of issues and concerns, and the SIGs are a great way of kind of codifying that and making sure that we bring those concerns together. Just one point about who can join the SIGs. Basically, any member can, but you do need to be a member to join the SIG. So if you obviously you're all joining as members and as trainee members, but lots of other people. There's 4,000 members in the faculty, and they are all welcome to join. So just on that point, and in the context, as I said, the faculty has 4,000 members. The majority of these are in the UK, but we do have members all over the world. We have 27 active committees. That might sound quite a lot for an organisation of 4,000 members and 16 staff, so that's almost 2 committees per staff member. But of course, committees in a membership organisation, committees are the lifeblood of a membership organisation. It's the way that the organisation gets things done. It's the way to get things discussed and aired and agreed, and it's a way that the faculty is able to sort of properly give consideration to all the issues affecting it. And it's a really key part of our government. So reporting to those 27 committees, or some of those 27 committees, are our 32 special interest groups. And I'll show you a map in a minute just to see where they report to. So just in terms of staff, the faculty, Maggie mentioned that we have a kind of very small but perfectly formed staff. It's just 16 people, so 15 full-time equivalents. We're really focused on delivering the core roles of the faculty and making sure that those core roles are delivered very effectively and very efficiently. Okay, a quick overview of where the special interest groups report to. So you can see this is all the 32 special interest groups. So you can see clearly that they report to all 27 committees. It's a small handful of the external outward-facing committees, and the Health Improvement Committee obviously very heavily represented, as are the Health Services Committee, and some of them, such as the Ethics Committee, just have one special interest group reporting to them. And at the top of the tree, it's obviously a board of trustees for the faculty, which is where ultimately all strategic decisions are taken about the faculty business. So, the role of the SIGs. Special interest groups are convened by public health members, and anyone can start a SIG if they want to. So, convened by faculty public health members to tackle the most pressing issues facing public health today. Some years ago, the faculty used to have quite a big active staff team involved in policy and involved in formulating policy. That went by the wayside a couple of years ago, and we took the view that very much that the 4,000 members we have in the faculty are the public health experts. You're on a training scheme. You've been working. Other members have been working in public health for years and years. You are the experts in the UK in public health, and we need to harness that expertise and that knowledge and that skill in public health policy, and make sure that your voices are heard rather than a small group of staff members who have not been trained in public health and who are not experts in public health. So it's really, the SIGs are really the way of engaging the membership, making sure that we reach out and get to those 4,000 members, and we have a way of harnessing and encapsulating that expertise. And so the SIGs provide our members with a platform to speak out on a particular issue. And obviously we provide the faculty in the kind of quid pro quo, provides SIGs and provides faculty members with that kind of reach and engagement and that impact, which obviously one person or one small group can't do. In terms of the support that the faculty provides to the SIGs, the SIGs are self-administered at the moment. We're kind of going through a bit of a transformation in terms of the IT in the faculty, and that will be coming to fruition the early part of next year, we hope. And at which point we can offer a bit more support around the membership of the SIGs and how we run that and how the membership lists are run. But at the moment, they're self-administered. But obviously, what we can do is offer SIG dedicated web pages on the faculty website to all the special interest groups. We can provide media and publicity. The faculty has 20,000, I think, at the last count, Twitter followers. Obviously, channels on YouTube, Facebook, the website, which is a very sort of broad and rich resource, and the members e-bulletin. Some of you would have received this already. This is a regular bulletin that goes out around the 1st of every month, and it goes to all 4,000 members. And it's a huge digest of everything that's going on in the faculty and all the latest news in public health. If you've read it already, you'll see how detailed and comprehensive it is. But it's a fantastic way of publicising and disseminating the works of the SIGs and what they're up to. And it's a very powerful tool. Another thing we can do is, in fact, I think mentioned specialty registrar projects. They tend to support either SIGs or committees on specific pieces of work. For example, we've had a specialty registrar supporting the new-ish Climate and Health Committee around setting up the strategy for the faculty around climate and health and climate change. And so there'll be other opportunities coming up in the next few months and years as well. On a more practical note, the faculty can offer telephone conference and video conference facilities and meeting rooms in the faculty's office. The faculty has been shut for the last 18 months with the pandemic. We are planning to go back into the office soon, and obviously at that point, at some point in the future, we can offer sort of physical meeting rooms for SIGs should they want them. Though I have to say the expectations around meeting rooms and the move to online have changed over the last 18 months with the pandemic, as I'm sure you're all aware, and I'm sure you're all kind of living this yourself. There is a decreasing demand for sort of physical access, face-to-face meetings, and people are just finding ways of doing things very efficiently, in a very organised way, online via Zoom and Teams and other platforms. So we will certainly have facilities to offer SIGs, but I think the demand for that may well tail off. public health doesn't stand still. It never stands still. And what we were looking at 3 or 4 years ago, we're looking at very different areas. 3 or 4 years ago, with faculty was doing a lot of work around the possibility of a no-deal Brexit and the potential for public health harm in that. That ship has sailed to an extent. So certainly in the last couple of years, there's been a big focus on equality and diversity and racism in public health. Huge push on climate change and climate and health, and the impact climate change will have on the planet and the health of people in the UK and overseas, obviously. And underpinning it and underpinning everything, as always, is health inequalities, and particularly the way these have been so exposed and so exacerbated by the pandemic in the last 18 months. Alongside that, the food SIG has been doing some fantastic work around food policy and food poverty, particularly again in the context of the last 18 months in the pandemic. The drug SIG is doing some great work at the moment, particularly on the back of the Carol Black review, which has just come out. And the alcohol SIG as well contributed to a fantastic report a year or so ago. And lots of ongoing debate around alcohol and minimum unit pricing, which is taking place is now established in Wales and in Scotland. So lots of different things going on. It doesn't stand still. It's a very movable landscape. So yeah, these lists will change, and the SIGs are very much the sort of eyes and ears of the faculty, and they will be the first people to respond, and they'll let us know what's going on out there. Okay, so this is where you can find the list of SIGs and details of how to join them and what they're up to. Kind of a health warning, I suppose. Some have been a little more active in the last 18 months than others. Obviously, the pandemic has had a tremendous impact on the kind of capacity and the workload of everyone working in public health. So I think it's fair to say that some of the SIGs have been a little bit dormant in the last 18 months, but they're all certainly starting to get back into life and started to pick up those work streams. So please do have a look at those SIG pages, and if there's any you fancy joining, just drop the chairs a line and you can join them immediately. If you think there's a particular SIG missing, then please do get in contact with me, and we can talk about setting up a new one. But for the moment, I'm sure joining an existing SIG would be a great way forward and a great way to sort of start advancing your particular knowledge area in a particular piece of policy.